Good evening. So this is the history of this case. Patient unable to open his right eye for 2-3 days. There is a pain in right eye, loss of sensation on right side of face, known case of hypertension and diabetes mellitus, past history of COVID positive. So past history is the operative word here. The patient does not have a COVID right now. No fall or trauma, no other complaints. So I'm going to mark some things. Can't open eye for 2-3 days. Maybe nerve palsy, maybe something going on there. But pain in right eye. Now, what are the things which you know in neurology will causes pain in right eye? One of the thing you have is optic neuritis, which is a very painful condition. Loss of sensation on the right side of face. Now, this is interesting. The patient has diabetes. This could be a neuropathy related, which we will not see on MRI any changes, will we? So I'm just marking the things which I'm feeling important, and now we will take a look at the case. And so this is going to be a quiz case, so I'm not going to tell you why my differentials. I'm just going to show you findings, and you guys will put the differentials in the comment box, and tomorrow I will tell you the what I think should be the differential. Let's see. Flare image. I will just scroll first. Is there anything you're finding? So here is the point. If you scroll MRI too quickly, you might miss subtle things. For example, there is a subtle hyperintensity here in the bilateral frontal lobes. These cortices should not be this thick. Also, if I'm not wrong, there is this edema here. Then we have sinusitis, right ethmoidal sinusitis, and also a bit of frontal sinusitis as well on the right side. A bit of bilateral maxillary sinusitis, but these are not that much filled, and sphenoid sinusitis as well. Now let us take a look at T2. Okay, this is gradient. Let's deal with the gradient now. So why is the gradient important? Had the sinusitis been fungal, that would have been hypo on T2, but that would also would have shown lot of uh, blooming on SWI. This is coronal T2. Again, you can see there is a sinusitis on the right side of ethmoid. Again, I feel there is this hyperintensity in the right frontal lobe, rather bilaterally, but here on the left side it is not that prominent. Bilateral maxillary sinusitis. Other than that, it's fine. T1 sagittal images. Alright. Just look at T2 in axial sections. What we have here is again mild hyperintensities. Right frontal, maxillary, no signal change in optic nerve as such right now. 61, not really adding much information. So what is the sequence you guys want to see now? Are we done? First sequence you should have asked me should have been diffusion weighted images. Now let us look at diffusion weighted images. Signal in the bilateral frontal. I will scroll it again. I will not tell you much more than that. If you need to see one signal to diagnose this case, you need to see only this signal, this sequence. That's it. To confirm that that is indeed restriction. Alright. So please give your comments and what do you think differential should be, and we will discuss it tomorrow along with one more case which we have for you. And that's it. Thank you and good night.